I actually have experienced both sides of the coin. I'm a diabetes specialist, but I also live with diabetes. So I've been that person sitting in the waiting room with my heart beating in my chest, thinking, oh, what are they going to tell me to do? You know, I'm absolutely terrified. This is a horrible experience. And now I am that doctor that people are coming into. So I do my best to try and put people at ease because I know just how horrible it is coming into that. And I think, unlike other long-term conditions with diabetes, it's so easy to judge the person with diabetes for their outcomes. You know, if somebody's got asthma and their asthma is not well controlled, they don't get into trouble for having poorly controlled asthma, but that does happen in diabetes and it absolutely should not. And what I say to a lot of my patients is, you're living with an untamable beast. There is nobody that I see in my clinic that has their glucose in range all of the time, regardless of what they're doing. And all you can do is continue to try and tame that beast, but it will continue to do what it likes. And you're just going to be going backwards and forwards in this, and it's exhausting, and I completely get that. But in terms of coming in and preparing for the appointment, I think, you know, think ahead. During the pandemic, for example, a lot of our appointments switched to telephone, and I found that a lot of people, you'd be catching them and they'd be in the middle of work and they hadn't had time to think about the appointment. And I don't think either myself or the person with diabetes got as much out of that. I think taking the time to think, actually, this is your safe space to talk about your diabetes and how it's impacting on your life. Think about it. What's important to you? What's bugging you? What are your where are you just now? Where do you want to get to? What changes, if any, are you willing to make at this point? And I think as a healthcare professional, what's really important is when that person comes into the room, that we create a safe space for them to be able to just launch at us with everything that's on their mind at the time. And if the healthcare professional is not giving you time to do that, then they're doing you injustice, because that first 5 minutes when you go into the room is your chance to really communicate everything that's concerning you. But and actually, not many people do this, but write down a list, bring it with you, because it's so easy to be lost in the moment. With you know, diabetes permeates every aspect of life. So plan ahead, write down a list, bring it in, and make sure that you get the most out of that consultation.
I love to prepare for my appointments, and I am one of those people that walks in with like a list of stuff that I want to touch on. And as silly as the question might be, it's always the case where you make a mental note that you want to ask something, and before you know it, you're leaving the hospital and you're like, oh my gosh, I forgot it. And it's such a trek again to get back in touch with your consultant. So I definitely make a list, and even if it's just silly questions, I like to make sure I touch base on all of them.
I think the key thing is preparing for the appointment, and I probably can't emphasize that enough. It's just knowing what you want to get out of that appointment. And I think many people have mentioned it already, but just having a list, and but if you prioritize it in your mind, what you would like, and make sure that's either point number 1 or number 2 on the list, then that's key.
And something that makes it feel positive or successful, I think in the past I have found myself in situations where a consultant might focus on the fact that I was like at 14 on a Tuesday at 5 p.m. and they'll be like, why was your blood glucose at 14? And it can feel very like tunnel visioned, and you just feel a bit like overwhelmed. It's like, I can't remember why I was at 14 a month ago. And then, like Emma was saying, you can feel a bit of that frustration, and you know, it's not very solution oriented. It's kind of like looking back at things you could have done, like things that went wrong, rather than being like, okay, so if you went to 14, like what are your steps in place that you have to manage your high blood sugars or things like that. So I find it very beneficial. Well, one, having my Libre data, my Freestyle Libre data has helped so much, because then they're able to see like patterns and trends. And the more that I use it, the more that it benefits them in my management in being able to give me insights and guidance. So the kind of more committed I am to my health and my management, I think that really makes it helpful as well. But then also when we go in looking at things holistically and not necessarily focusing on the tiny details that would make me feel overwhelmed, but just touching base on my management plan and how I'm feeling. And I've also found it really successful visits when we also sit down, and I know sometimes it can be hard if there's a time constraint, but when the conversation's also about how I'm doing as a person, and you know, touching base on my life and where I'm at with like stress or happiness or other parts of my health. Because, you know, it wasn't, you know, even as a woman who experiences a cycle, it was only like a couple years ago, and I've had lived with type 1 diabetes for over 13 years, where my cycle even came up in an appointment with a consultant, and that has a big impact on glucose levels. So when I feel like the care is holistic, I can then walk away and feel like I've got an action plan, and I feel more empowered rather than like feeling judged or in trouble for certain things. I just want it to feel very empowering.
So you can be anxious before you even get through the door. You can be anxious the minute that letter arrives on your doormat. So it's worth bearing in mind sometimes that if you know that these appointments make you very anxious, trying to do your best before you get there to put that relaxation into place so that you can go through the door in the best possible mind frame. Because we know that when people go into appointments anxious, they're less likely to take in information. They're more likely to pick up on bits of feedback that may not be designed to be critical or negative, but they're more likely to feel negative. Anxiety come up really, really quickly, often before you've even realized what's happened. It's really important, like Daniel was saying, that people try and communicate as much as they can with healthcare professionals around you, especially if you've had previous negative experiences. Now, if you don't feel in a position where you can do that yourself, you do have the right to bring other people into appointments with you. So if you don't feel that you can raise these issues yourself, maybe asking a friend or a partner to come in with you, that can be really useful. And as Daniel was saying right back in the beginning, you do have the right to switch diabetes consultants and diabetes teams if you need to. If you feel that that relationship has broken down, nobody should come out of clinic feeling worse than when they went in.